this month's webinar. I'm going to give a couple of minutes before we kick off and get started. To those of you who have been listening to our conversation so far, I've been just chatting with Dr. Jessi Gold as we wait for people to trickle in. She's our wonderful speaker for today. So I'll give it a couple minutes until we get a couple more people and give a little bit more time. But in the meantime, remember to tweet out that you're at the webinar, and hopefully we'll be able to get even more engagement. Feel free to live tweet during the webinar. We love social media engagement, and make sure you ask questions in the Q&A as we go through, and we'll get started in a few minutes. Thanks, everybody. All right, I'm going to give it one more minute. All right, everybody, welcome to our last WIMS webinar episode before the Women in Medicine Summit Conference that's taking place this October 9th and 10th. And of course, with COVID, it is a virtual conference this year. I want to just give you a couple of housekeeping about the summit and then a couple of housekeeping notes on today's webinar, and then we'll jump right in. So first of all, if you haven't registered for the Women in Medicine Summit yet, if you register after today's webinar, the 5th person who registers will be receiving a WIMS t-shirt, as well as the 25% off that everybody who attends the webinar will get that discount code. But if you're the 5th registrant, you will also get a free t-shirt. So make sure you register and time it so you're number 5. The second thing, so of course the webinar for today is on a topic that is very near and dear to all of our hearts. It's really important, and I'll be introducing our guest speaker in a minute. For housekeeping, if you have questions as we go through, please feel free to put them in the Q&A, or you can put them in the chat. If you put it in the Q&A and you want to remain anonymous, or you don't want us to mention your name, feel free to put that in there, and we're happy to ask questions anonymously as well. Throughout the webinar today, we are very fortunate that Lauren Green from Dancing with Markers will again be doing a live digital scribing of the event. Basically, it's visual note-taking that's done with an iPad to produce this very high-level summary that will really solidify the key takeaways from today. You're going to get a copy of the digital notes after the event as a thank you for attending. And at any point, you can pin her video to watch her drawing as she does it live in the moment. For those of you who attended the summit last year, it was pretty impressive to watch her. All right, so today's topic is a very important one. We're talking about mental health in this very extraordinary time we're living through. And I am so honored and excited to introduce you to our guest today. I'm going to give you a little bit of her bio. She's really an extraordinary woman. So Dr. Jessi Gold is an assistant professor and the director of wellness engagement and outreach in the Department of Psychiatry at Washington University in the St. Louis School of Medicine. She works clinically as an outpatient psychiatrist and sees primarily college and graduate students, as well as faculty, staff, and hospital employees. She also teaches and mentors students and trainees. Dr. Gold is a graduate of the University of Pennsylvania with a BA and MS in anthropology and the Yale School of Medicine. She completed her residency training in adult psychiatry at Stanford, where she served as chief resident from 2017 to 2018. She has received numerous awards and accolades for her many contributions in the areas of mental health and psychiatry. She is a nationally recognized expert and speaks at national conferences is interviewed regularly for news outlets ranging from the New York Times to Teen, and consults for publishing and media. Dr. Gold is particularly interested in college mental health, women's mental health, and gender equity, physician wellness, medical education, and the overlap between popular media, stigma, and psychiatry. While she has published frequently in the more traditional method of research papers and academic publishing, she has also enjoyed teaching about mental health topics and decreasing stigma through writing for many popular press outlets. For any of you who overheard us chatting at the beginning, we were talking about Dr. Gold's exceptional contributions to Forbes that if you have not read, you must read. They are really excellent pieces. She has been featured, among others, in the New York Times, the Atlantic, the Washington Post, Time, Vox, Newsweek, Self, InStyle, Glamour, and the Huffington Post. She's a member of the APA Council of Communications, the Psychiatric Times Advisory Board. She's a founding and steering committee member of Times Up Healthcare, and she's on the editorial board for MedPage. She's extremely active on social media, especially Twitter. And throughout this talk today, please feel free to tag her at Dr. Jessi Gold. She was also named one of Medscape's top 20 physician influencers on social media in 2019. So, I mean, for someone so young, that bio, I think I probably could have kept on talking about her for even longer. She's really exceptional in what she does. So thank you, Dr. Jessi Gold, for joining us today. And I'm going to start off by confirming you are okay with me calling you Jessi throughout this webinar today, because I feel like you and I are friends, and I think we could probably do first name basis if that's okay.
Yeah, absolutely. You know, it's funny because this is a women in medicine thing. I will point out that on most media things, they ask that. And my question is always, what did the men do? And they're like, what do you mean? I'm like, well, you know, if you call me Jessi, but every time you've ever had a man on here, you call them doctor, whatever, I'm not playing that game. So I'm comfortable with you calling me Jessi, but we're not playing it if you will call all the men that. And they're like, oh, okay. But yes, you can call me Jessi.
And I'll tell you, I call all the men by first name too, and I don't actually even ask them if it's okay. So we are talking today about mental health, COVID-19, and we called it the silent struggle because it's something a lot of people don't talk about. You know, you do so much outreach in so many different levels, and this conversation today is going to be more of a fireside chat where we're just kind of talking and getting some experience. As you've been navigating through this pandemic, what have you found are the biggest challenges and struggles that people are coming to you with? I mean, our healthcare workers are really struggling. And so I'm really curious as to what types of things people have come to you with, and how have you guided them in this very exceptional time we're in right now?
It's a really good question. I mean, it's been hard. And I think I'll just say that up front. It's been hard and challenging and different and nothing that any of us have experienced before. And I think as providers and as patients, and I think that makes it even harder to do our jobs. And I think at the beginning, it was not as busy. And I think people were really focused on like really just safety. Like, I'm going to go home. I'm going to take care of my kids. I'm going to take care of my house. I'm going to get my food, and I'm going to do everything that I'm supposed to do and like be in the house for a month, and then it's going to be over. And that's it. Right. And we didn't have like an influx into mental health. People were doing okay. You know, I mean, even healthcare workers, honestly, were really adrenaline focused and doing their jobs and doing the frontline work they needed to do. It was really hard. It was nothing they've ever seen before, but we don't talk about those things. And so we were just going, right? And I think once you had like a second to breathe, that's when it became a problem. So either healthcare workers had a pause because the curve kind of flattened or dulled, or like we got to the point where the rest of the country, or, you know, my other patients, like college grad students, kind of went, wait a second, this is not a month, this is much longer. I don't get to go back to school this year. And then even longer, right? I don't get a summer, I don't get fall, like this kind of perpetual indefinite uncertainty, I think has just propelled like a lot of anxiety, which makes a ton of sense because anxiety is all driven from uncertainty. And so if you can't give someone answers about anything, they're just going to be super nervous. So I think it's been a lot of like, a lot of normalizing, a lot of just like letting people talk and have space for it. a lot of like letting people, like making people aware that what they're experiencing is probably mental health related. So a lot of like, I'm exhausted. Yeah, what do you think that is? And a lot of like, well, it's sleep, or I've been running a marathon for months, because that's what anxiety is, right? Like you've been like running from whatever you think is coming, or preparing to run from whatever might come for as long as you can. And that means you're not sleeping super well. It means your muscles are all tense. That means you're just ready to go, right? So you just been running. So you're going to be tired. But there's this like cognitive dissonance between the fact that like that can cause physical stuff. So people will just come and be like, I'm just tired, right? But it's mental health related. And I think like kind of pointing that out and sitting with it has been part of what I've been doing. I think in my job, because I'm a prescriber, one of the things that's been kind of hard is like, what is baseline pandemic and what is medicatable? like, and I think I'm still struggling with that really, which is like what's really interfering with your day-to-day life in a way that medication can help, versus like what should you be talking about and how can we talk about this and what can coping skills help with. And it's still hard. And I think the longer this goes on, the more people are going to end up coming to me and hope that meds can be an answer. But again, like there's no really good answer to what it looks like.
So how are you helping healthcare workers cope? Like what, I mean, you know me, I'm all about, here's the problem, let's come up with a solution. I mean, people joke I should have been a surgeon because I see a problem, I want to like take care of it. But this is not, I mean, you made the very good point. This is a marathon. When we started, I really was thinking, okay, 3 to 6 months, we can make that work. You know, yeah, it's going to stink, but we'll figure it out. We'll hunker down. But now, I mean, they're talking about 2022 is when we can get back to normal, which I think, I mean, that is far away. And we've crossed 6 million known cases in the US. We've crossed 200,000 deaths. I mean, we're entering into flu season. So what types of things are you helping people with? How can people cope? How can people adapt and navigate through this without, you know, without medication, or before they get to the point where they need medication?
Yeah, that's a super good question. I think there is a desire to solve all problems, right? Because we like solutions, but we don't have solutions to most things. Actually, we just think that we do. So we have to sort of get to the point of like, uncertainty is okay. We don't like that, especially as healthcare workers, but there are times where we don't know. And patients like when you say you don't know, even if it's kind of uncomfortable, because there's like a sense of like you're human in that, right? You know, I've been trying to help with that idea, because that's kind of called like psychological flexibility, which is like being comfortable with the fact that you can live like day to day and that's okay. You're in a field where people live day to day and they survive, and they are okay with the fact that like one day might be harder than the next, and they are okay with that because they have today, and today was a good day, tomorrow was a different day. What was today like? What are the positives of today? What can we focus on that was like something hopeful about today? What are things that we can get done today that make me feel like I got something done? I think we make these like grand goals, like these are the things I'm going to do in the whole year, or like these are the things I'm going to do for the week. And they're great, but like they're really big goals. And so when we have to-do lists, they don't get done, or they don't look like they get done because they're so big. And so it doesn't feel accomplishable. And so we feel pretty like defeated and useless, because honestly, like our concentration's off and our ability to get stuff done is not as good. And so we're like mad at ourselves that we're like not checking things off our to-do list. And so like I always say, like if you're supposed to write a paper, your to-do list should be like write the introduction, write the next one, you know, like write the methods, write the results. And like that feels gross because you just added like 10 things to your to-do list, but you'll get to check stuff off. So it's kind of a toss-up, but at least you feel like effective and productive, and that's kind of the point, you know? And I think you focus on that and you try to shift your mindset a little. So that's part of it. You focus a bit more on community and community support. I think that's really important in medicine. I think we tend to sort of like know that it's there, but also close in. And so like we support each other through like, you know, like we do our shifts and we're in a team for the shift, but like emotional support is not part of that because we don't really not want to talk about that stuff. But like if one person says like, this was hard and like sort of like breaks through that, there's this like sigh of relief that you can like tangibly feel in the whole team, that it's like, I wanted to say that the whole time. Why didn't anybody say that? And it's like, gives space for it. And it's really nice. I mean, we've been doing like when the teams ask, but I mean, also trying to go and ask if they need it, like some kind of support groups and outreach where needed. And for me, that's been like, I've done everything from like the chaplains and rabbis on the undergrad campus to like the ER doctors in the med school, because I do like sort of the gamut of the university of what I'm doing. And, you know, like people ask me to do that stuff and just listen to what they're going through. And I'm not doing anything, right? My presence gives them permission to talk because they don't think they can talk without me there because it's not the culture to talk. And so like having me there makes it like an official time to have a psychiatrist and talk about feelings. Without that, they felt weird, right? Like it was like, why is the boss talking about feelings? So it's like a school sanctioned feelings time, right? And I think it just makes it feel like so many people are struggling from like the whole hierarchy down. And I think that's really important to getting through this as a team. I think when you're in the higher parts of the team in the leadership roles, it's going to be really important that you start to model that, like in huddles, in like if you have a bad event, if you have something you're experiencing, that the culture starts to shift. I'm not saying like you need to be like, hi, I'm Jessi and I take this antidepressant and I see a therapist all the time. Like that's fantastic, right? Like I talk about seeing a therapist, but I don't say like, I see a therapist for this and every day we talk about this, right? Like that is my personal conversation and it's my decision if I share that. It's my decision that I share that I go to a therapist because I think it's hypocritical to be a mental health provider who talks about physician wellness and doesn't actually talk about what I do, because I just think it is, and that's a personal opinion. But people think that we have to like floodgate open this conversation and like we have to talk about everything. I'm just saying like, hey, this is hard. Like, you know, my kids are home and I can't get stuff done. That's all. Like that alone makes it feel like feelings or like conversations about things other than work and patients and whatever are welcome in the conversation, you know? Like I think that we worry so much that it has to be like an all or nothing thing or like a diagnostic thing or like a treatment thing. And I don't see it like that. I just mean like giving space and like conversation and room for anything that people want.
So I think, you know, you bring up a lot of really good points, and I'll tell you, for me personally, so I struggle sharing emotions in general. My husband jokes all the time. He's like, you're a robot. You don't tell me what's bothering you. You just deal with it. And that, I mean, that's how I am. I've always been somebody who I just, like I said, there's a problem, I take care of it and I move on and I, you know, move to the next problem that needs to be taken care of. Going through something like this, I found, you know, the first couple of months, I was so stressed and anxiety, like just, I had so much anxiety and I didn't realize it. And it was manifesting physically. Like I was having stomach aches. I wasn't sleeping. I was really short with my family. I was really, and it took somebody from my family to say, hey, are you okay? Because you're not behaving in a way that is your normal, upbeat, optimistic self. Like what's happening? And I really thought, well, it's a pandemic, whatever. I know the issues. I'm dealing with it. It'll be fine. But then I started developing these actual physical ailments. My husband was like, maybe you should go see your doctor. And I had a doctor's appointment. I talked to her and she was like, you sound really stressed. And I wasn't even opening up, like you said. It was more just me talking about my day and talking about, the things that were going on and talking about my kids and talking about work. And then I brought up my stomach aches and she said, yeah, you don't need like a endoscopy appointment. You need to like meditate. And it was like a switch went off in my head where I didn't even think, and I'm a physician, I'm an oncologist. I tell patients this, but the thought that this level of stress and anxiety from everything that was happening was manifesting itself physically to me was just not even in my brain space. And so I think for a lot of us, we as physicians, and especially as women physicians, whether we have kids or not, whether we're taking care of elderly parents or not, we think of ourselves as superheroes, right? And there's all those pictures that have been out there about healthcare heroes and the Superman complex or the Superwoman, feeling of we need to be able to do everything. And having these conversations like you're talking about, especially women, worry that it's going to come across as a sign of weakness or a sign of, well, I'm not up for the task or I'm not good enough. And then imposter syndrome starts feeding in where you think, well, I can't believe that I can't accomplish this despite the fact I'm teaching 3 different children their virtual learning in 3 different grade levels at home. And I have, if you're in academics, I have a grant due, or if you're in clinical practice, I have 30 telemedicine visits and my child is vomiting and my other child is trying to ask me how to do long division. And we think mentally we're supposed to do all of these things. And then we don't want to ask for help. We don't want to talk about these things because it makes us feel like we're not enough or we're going to be seen as less because we're women and we're juggling these other things. So how can we get around that? I mean, I know it's a culture thing because the problem at a lot of these institutions is that is the case. If you bring up these problems, your leadership may not be willing to accept the fact that you can't do what you're supposed to do by a deadline. And I mean, I've seen a lot of great leadership throughout this pandemic where people are being given cut slack and given grace and, told it's okay, extend your deadline. But I don't think that's the case for everyone. So how do you navigate, or how do you recommend people navigate that type of thing where they need to be emotionally open and they need to be able to express their frustrations and their stress, but also still maintain that level of professionalism at work that gives you the authority that you need to get done what you need done?
Yeah, I mean, I think it's really hard. I think that a lot of these things are not going to change tomorrow. I have a lot of faith that we are moving at a faster pace than we ever have, simply because most things are. And the good thing about a pandemic is it shows the faults in systems, and hopefully that means that they change. I realize that is dependent on a lot of things that might be outside some of our hands, but for me, the talking about the money kind of thought process, investment in structural change from a higher level around this is much different than anything I've seen in a lot of places right now. And so I do think that there's some hope on that side to have it move a lot faster than there's a requirement for the ACGME that we do this, or the LCME that we do this. Let's just give a lecture and check a box, right? Which has always been what they want to do, and not actually ask what you want and what would help you. And I think that there's a little more how do we start with actually solving a problem that would help you? What do you need? I think there's a little more of that. That doesn't mean that every workplace is like that. Don't get me wrong. I'm very well aware that you can work in a workplace where this idea is very idealistic. And if that's true, I think that you then have to be this is this is an unsafe place for those conversations. This is a boundary I have to put. I need to find somewhere else that's a safe place for those conversations, because I can't have that eat inside me all the time. Because even if they don't come out in the workplace, which I mean, it's okay if that's not where you feel comfortable with them coming out, I think for the most part, I can't cry in front of my patients. I don't want to cry in front of my patients. It's unsafe for me to, it's not appropriate for me to do that, because that takes up their space and then they're worried about me. That's not what I should do, right? And so there are things we still have to put boundaries up around, right? And so I think we do have to say, this is not a good workplace for this conversation. who is a safe person for this for me? Is it a spouse? I don't know. Is it a friend? I don't know. Is it a therapist? I don't know, right? But I think it's really important to try to figure out where that safety is and find that, and like learn to negotiate where you feel safe with that otherwise. Because what you end up doing is just getting all negative emotions in one place and one set of positive emotions otherwise. And you can kind of learn to negotiate the skills around that and learn to better cope with the situation that feels out of your hands. You know, I mean, I think there's always ways to kind of chip away at the change, but if you have like no control, it feels horrible. It feels so hopeless for a while. Like just going and feeling sad and raging will not make you feel better, right? Like that feels very much like accept the things I cannot change for a second, because otherwise you will just, it'll just like really, really weigh you down. You might want to switch workplaces, but I also know that's not something lots of people can do, right? So I think we kind of have to do these like balances, right? Which is like, how do I protect myself while also figuring out where I can have a safe place to like exist? Like, where can I be? You know, does that make sense?
Yeah, no, that totally makes sense. I think the biggest thing for me, because I was going through a job transition when all this happened as well, which added another whole layer of complication and stress. And I think that a lot of people don't necessarily reach out to people at work, but they might be reaching out to family or a pastor or a chaplain or friends. Obviously, during the pandemic, it's been more challenging to do that. But Zoom, and everybody knows how to use Zoom or WebEx or something, FaceTime. So I think it's really important. Like, so I give the example of my brother. My brother lives in New York and he's single, and he went like, I think it was 4 months without seeing another person other than over Zoom. And I mean, it majorly affected his mental health. To not be seeing people is stressful. And then on top of that, you're worried that every time you open the door that you might be, COVID might be coming in. So I think that there's just the value of that human connection wherever you find that, I think is really important to remember. It's very easy as we navigate this pandemic to go inward and kind of I'm an extrovert, and for me, not being able to see people, I literally like it was I don't know how I managed not going out and seeing people and talking to people and interacting. And I started to get reclusive and more reclusive. And I told my husband one day, I said, maybe I'm actually an introvert. My husband looked at me, he said, you are definitely not an introvert. We need to do something for your mental health. So I think it's one of those things where you have to figure out where those outlets are and figure out who you can talk to. Because if your work, like you said, if your work isn't a safe outlet, then maybe it's somebody else who you feel close to. I mean, there's such a, go
I
ahead.
mean, that's why, I mean, to be honest, that's why therapy is great. You know, like I think people are super scared of it in a lot of ways because they're like, who is this person and why am I talking to them? And why do they get to know all of these things about me? And I don't know them. And why should I trust them? Right. But that's kind of the point. Like the good thing is you don't know them, like in a lot of ways. Like I think people think that it's like bad, but actually like the positive is you don't know them, because the problem is we dump a lot on the people we love, and that makes it really hard sometimes because like one, a lot of the problems are with the people we love, and then also sometimes that makes it very complicated to then negotiate all the rest of stuff. So like they want to tell you you're dumping a lot on them, but they don't want to say that because they love you, and they don't want to tell you to push away, right? So it's just, and it's hard to always know when you're doing that. But if you have like another place to go, just like a neutral place. Plus, like the people we love don't always tell us, like, don't like reflect in the same way as a therapist would, because like they don't know you, and their purpose is to like help you see you as like a mirror, as opposed to like, let me solve your problems in the way that I would like you to solve them as like your family member or your spouse or whatever vested interest I sort of have, and we'll like somehow negotiate into this conversation, you know? And so that's like, to me, one of the benefits of having a therapist. Though, of course, like I understand that there are so many barriers getting one, there's so many other things, and like time and access and like, don't get me wrong, I'm well aware the mental health system is a mess, But, like that to me is like one of the benefits of that for sure.
So talking about, family members and helping family members cope, a lot of people have kids or nieces or nephews that they have to talk to about this. I mean, most of you know I've got a 6-year-old, a 2-year-old, and a 2-year-old, and I was convinced that I'm permanently scarring all 3 of them because they know more about coronavirus and COVID than probably a 6 and 2-year-old should know. But I mean, they know they need to wear their masks, they know they need to wash their hands and all that kind of stuff. But one thing I've really struggled with is talking to them. And I think that is a challenge a lot of people, whether they're parents or not, have faced when they're talking to their own kids, whatever age they may be. And obviously it's a different conversation depending on what age your kids are, or talking to, nieces, nephews, talking to other family members and helping kids really cope, because this is a strange world we are currently living in. So how do you navigate that? How are you recommending people talk to their kids about this type of stuff?
Yeah. So I see big kids more than little kids, but I can give you some kind of thoughts on how to do it. I mean, I think kids are more resilient than we think. Like, we like to think that we just scarred our children with everything that we've ever told them to do, but they're quite flexible. And for the most part, when we put kids in these like schools with rules and things, they kind of figure it out and they're kind of okay. We're the ones that are the stressed out ones, right? So we're anxious and our anxiety is projecting. It's not usually the kids. There are kids that are anxious, of course, right? But they're not the majority of the kids. So I think that's one thing to keep in mind is kids are pretty adjustable. A lot of kids are pretty adjustable. 2, we try to hide a lot of our feelings and like truths from our kids. That doesn't help. I'm not saying, again, that you need to like tell your kids everything and cry like ridiculously in front of your children, but I do think it's helpful to have honest conversations and like feelings time with your kids and give them, like, teach them it's normal to talk about feelings. And that's every age, because I think that when you don't, they don't, and then they learn that not expressing feelings is the way to go. And what that does is then they just kind of go about their life learning that hiding things is better than telling you. And so then we do what we all do, which is hide things until they're a crisis or never tell anybody, right? And it's much better if you're like, this has been really hard. Look, like, let's talk about what's been hard about the pandemic. Like, you're really sad that school got canceled. Okay, that's been hard. Let's talk about like what's been good. Do like a what's been good, what's been hard, like make sure that you like have a balance, but also talk about the hard stuff too. Because I think kids like do see it. They know that you're struggling. They see you're at home. They see that you're balancing stuff. They can sense when you're anxious or angry, or like they get the brunt of it sometimes too, right? So I think it's important to have those conversations. With older kids, like high school, college age kids, the people that I tend to see in clinic, I often tell them, like, parents can't read minds, and like slamming your door and just like expecting your parents to know why you did that is not helpful. But like, having a conversation with your parent about why you did that would be a lot better. But the ways that I tell them to do that is like, your parents, if you don't want them to nag you about your mental health, you should have a conversation about how you'd like to be asked about your mental health. So like all my patients who have anxiety or depression, or especially things like an eating disorder, when their parents know that, then they'll be like, oh, you're not eating again. Something's wrong. What's wrong with you? Want to tell me about your eating disorder? Oh no, I noticed you're not eating, right? And then they get all like worried and they're like, my parents are watching everything that I'm eating and I can't even be at home and this is horrible, and like send me back to school, right? That's not helpful. And so what's more helpful is like, I'm worried about you. I want to be able to tell you what I notice, because maybe you don't notice it all the time too. What's the best way that I can check in with you? Or like, how can we have these conversations in a way that doesn't feel like I'm like stalking you, or, whatever word is better than stalking. But I think, we can ask that. People know how they want to be checked in on. Some kids might feel fine being asked often. Some kids might say like, you can ask me once a week. Some kids, it helps with boundaries, teaches like how to express like good communication skills. And I think that that's helpful too.
I think that's great. And one thing I've started doing with my daughter is every night I ask her, what's one good thing that happened today? And what's one thing you wish was better tomorrow? And that has really helped kind of her express her feelings. Initially, I wasn't doing any of that. And she was just getting stressed about everything. And she was just like, Mommy, today was just awful. It was the worst day ever. And she couldn't verbalize why it was the worst day ever. So now, luckily she hasn't been having as many worst days ever, but we've been able to kind of discuss it. And I think that's really important, and to start it at a young age if you're able to, because I'm very fortunate that I have a very good relationship with my parents. So I have an open dialogue with them. And I think my mom back in the day, who didn't know any of these things, but that was just the way that she knew to do things. And so that it's something really, it's smart to start that as soon as you can with your kids. So we actually have a great question that came in through the chat. And the person was asking, as a newly graduated student, I found this time to be incredibly isolating. There wasn't a lot of support from my school, and I also didn't have family close. What suggestions do you have for that? And I think, I mean, whether you're a newly graduated student or somebody starting a new job, or even somebody who's been in a job, I think this has been a very isolating time. I was on a webinar earlier where one of the oncologists was like, yeah, the way I cope is I go out for a glass of wine with my best friend, and I haven't been able to do that in 6 months. Like, how am I supposed to continue living like this? So what do you tell people like that? How do you suggest they kind of cope and deal with this time that can be very isolating overall?
Yeah. That's a good question. It is super isolating. I think we take for granted also how often like we interact with people in our day-to-day life and don't realize it. So I think that we are well aware of the like planned encounters and the like, you know, classes and work where we like see people. We also like drive next to people or like see people at the like mailbox, or like, you know, there are people everywhere, right? So we have all these like kind of casual encounters that also contribute to sort of like giving you socialization that you don't think about. So there's all these like little things that add up. And so you do see a lot more people than I think you realize during the day. I have had to kind of reconceptualize what socializing means. And I tell my patients to do the same, which is it is not going to be what you want it to be right now, and it can't be what you want it to be right now because there are lots of rules, but you can try to figure out what you feel okay doing within those rules and plan things. You have to plan things. So it is not a world for just like the people who think that friendships happen. So I have a lot of friends who hate planning, would like yell at me for saying like, can we go to dinner this week? Because that stresses them out. They want to be like at somewhere, and then if they want dinner, they can tell me they want dinner, and that's how they function, right? Like I have a lot of friends like that. That does not work in a pandemic, and it does not work when you're lonely, because you need something to look forward to, and you need to know that like you still have friends and they still exist and you have things to do, right? So you have to plan, and that's stressful. It's more work, honestly. It's more work up front. And like you have to plan to do things where you see people. So either outside walking, social distancing, masks, all that, things that you can do like picnics, distance eating, like things like that, because you can do that. Or, you know, video, even though it gets exhausting after a while, more than text messaging. So text messaging is not a replacement for a conversation either. So that's the other thing I've had to remind people. So we've gotten really used to feeling like that's an appropriate way of checking in with our friends. It usually is, because we have 1,000 human encounters during the day. So if you're like a doctor, you see people all day. So you're like, I saw people all day. I'm exhausted of people. I saw my friend on the phone. That was fine, right? Because I texted them. They know I care about them. I said hi. I had a good conversation. The end, right? But really, right now, that's not enough, like to give you the same like feedback as a person who's lonely. So you have to plan stuff and realize that text messaging is not going to help. So you have to plan stuff where you see people. and actually like see people. And I think that's been the main advice that I've given to people is plan things to look forward to, plan things like it's Monday, I have stuff that I'm doing for most of the week and you know what I'm doing and that'll make me feel better. Even if I feel a little lonely today, it's okay, I have something on Tuesday, like that kind of thing. And don't just text.
Yeah, I think that's a really important point. So I noticed at the beginning of the pandemic, all these people were doing like they're reconnecting with college friends or med school friends or residency friends, and people were doing Zooms. And I reconnected with some of my friends who I hadn't talked to in years, and we did like a group chat. And now, 8 months in, it's harder for us to actually all coordinate, and there isn't as much. I mean, people are going back to work, so there's not as much flexibility as there was initially. But I still think it's really important. My husband and I have done a couple of Zoom double dates with friends where we'll make our own cocktails and we'll chat with another couple. They actually, our friends are much better at it than we are. They like plan board game nights with other couples. And I don't know how they do that because I don't know how I could play a board game over Zoom, but people do it. So I think you're absolutely right. It's one of those things where you not only need to have something to look forward to, you need to remember the personal connection, because like seeing your face on this webinar, I mean, we talked for like 10 minutes before, and when I got on this webinar, I was so exhausted and I was like, I don't want to do another Zoom. I'm so tired. This is gonna be another hour. But just seeing your face and talking to you about, your Forbes article or just life in general, it does have that rejuvenating power, and it has that feeling of, oh, we're still connected. There are still people out there that, that know me and care about me and want to talk to me about things outside of just text messaging. So I think that's a really, really important point. So I know that we've got about 15 minutes left, and I want to make sure that people get a chance to ask their questions. So please make sure you put your questions in the Q&A or in the chat, because Jessi is a phenomenal resource. So make sure you throw some questions in there. How do you normalize all of this? Like, how do you normalize the fact that people are struggling? What do you say? Let's say one of your friends comes up to you and says, Jessi, I'm struggling. I don't know what to do. Like, help me. What am I supposed to do? I'm really struggling as I go through this, and I can't see myself doing this for another, 6 months to a year. What do you tell them?
I usually say something like, I don't like the word unprecedented, but there's never been another time that I can think of that there has been a global pandemic on top of systemic racism, on top of like riots and unrest, on top of an impending election, on top of, whatever else like you want to put on top of that. And so I would be surprised if you weren't struggling, in fact. And I actually wouldn't believe you if you told me you weren't struggling. And the question is, since it's pretty normal that you're struggling, how do we make it so that you feel okay enough to be able to get through? Because we don't actually know when it's going to end. And that's the part that's the hardest. And I think that's the part I don't have a super great answer to. And I think that I usually say that, and I say like, part of the thing that's hard for me is I don't have a great answer to how do we get to the end and how long do I have to do this? And I wish I could tell you that. And the uncertainty and the like sitting in the yuckiness is actually part of what we have to learn to get to be comfortable with. And I don't like it either, as like in my job or in my friendships or in my life, but like perhaps because we all learn to do it and we can do it together, we can learn to be like stronger, more hopeful, find the light in it, like, find things that make it better in the long run. I think we just we don't have a choice but to get through it,
So Dr. Vinny Aurora, one of our good friends, just typed something in that I think is really important, and I think you should talk about it for a minute if you can. the concept of doom scrolling and social media and taking social media breaks. And, you know,
I've been. She says that because she talks to me at 1:30 in the morning.
So I'll tell you, you know, we all struggle with constant barrage of information, and we've all been in that place where we've been, for those of you who don't know, doom scrolling basically is constantly scrolling through your social media feeds and seeing the fires in California, the killer bees, the election, Ruth Bader Ginsburg passing away, John Lewis passing away, like Elijah Cumming passing away. I mean, it's like the systemic racism Jessi was talking about. I mean, it's like one thing after another after another. So I encourage people to take social media breaks. I definitely don't take as many as I should. How do you suggest people navigate social media in this time to maintain their mental health, but still stay up to date as much as is needed?
Yeah, good question. So really hard. So as a person who is a college mental health provider, I usually would say social media has a lot of downsides, right? So I would say the research is mixed, but a lot of the research would say causes depression over a bit of time, causes like social comparison and like lack of self-esteem, causes anxiety over time. People curate themselves, and that doesn't help because then you think that everyone's life is perfect and your life isn't, right? So I would tell you that would be my baseline of social media with my patients. However, you just told me that people are isolated and lonely, right? And so when people are isolated and lonely, and there's not a lot of stuff to do, and for a while we actually couldn't do anything, social media was like it, besides like going on video and only being on video all day, right? So I can't say you can do none of it. So we needed it for some capacity, and we still need it for some capacity for the socialization aspect. And it still has benefits for that right now, for sure. And I think that you have to say, okay, it has socialization benefits, 1. 2, it's by far the best way to be informed, you know? And like, if you're a person who does what we do, it's really hard not to be informed. If you're on here, probably like an advocacy kind of type of person too, which makes it even harder not to be informed. So that you have to be able to say like, okay, so I need social media for some degree of socialization and some degree of advocacy. How do I then say, okay, that's one thing, but I don't want to go down the like, all I do is sit on social media. It's bad for me. It's making me depressed and anxious. And it's like that movie on Netflix, The Social Dilemma, which is like the worst thing that I've ever seen. So watch it. But, you know, basically what you have to think about is a couple of things. 1, like try if you can to like limit the sources that you're reading for the news. It's very hard to do, but if you read a million, you'll go down a million rabbit holes and it'll just make you angry. 2, try to check your emotional reactions. If you're literally just mad and anxious, you gotta stop. Because if you just get to the point where like all your emotions are negative, like you're just gonna feel really bad and there's no outlet for that. So you kind of have to start like checking that earlier and like making sure that it's giving you positive feedback as opposed to negative feedback. So once it starts giving you negative feedback, you're just going to go down the rabbit hole and keep going. It's just making you more and more angry, and you had to have stopped that earlier. 3, I try really hard, even though I'm on it very late, Vinny, to put my phone somewhere at least for the like 20 to 30 minutes before I actually go to sleep, and spend the 30 minutes before I go to sleep doing something that is not reading about doomsday things. I do not want to dream about it. And I also want to get some amount of hours of sleep. I had to do that. Like I noticed at the very beginning of the pandemic that I had this it was basically like, I thought if I wasn't on social media, like people, like you guys on the front lines, like we're gonna like, it was like, I wasn't paying enough attention to you. And it was like, it was bad, and I was like gonna hurt you guys, were gonna be hurt. It was like this thing. And so I had to like go, that's not an acceptable reaction. Like you can sleep. You need to be able to take a break too. And so how do you do that? So then I started listening to podcasts before bed and reading before bed, something that is really dumb. Like that has absolutely nothing to do with the downfall of the world. And that has been helpful because it like recenters me in some capacity to like being way off that. Sometimes I'll watch like Vampire Diaries too, because that's currently what I'm watching on TV, which is like sort of doomsday, but it's like about something totally bizarre. You know, and like that's been helpful too. And so that helps my sleep, and it has nothing to do with that. And I think that was a limit I set on myself. Some people put time limits on themselves. I think that can help. You can force your computer and phone to do it for you if you want. You can force a friend to do it for you too, you know, but I think that can, you know, you can put like parental controls on your computer and your phone. It's just like that can feel a bit like silly. I do think like as we get closer and closer to the election, these kind of thoughts need to be in your mind, because I think it's only going to get worse. And the like barrage of news and the anger about it and the feelings. So I do think we have to think about how to protect ourselves around that, or we're just going to feel bad all the time.
Yeah, I think you brought up so many important points. I had gotten to a point where I was on social media all the time. And again, because I'm not really seeing anybody other than my family. I mean, my patients can't really say anything about my social media use, but my family was like, you need to take a break because it's affecting your personality and you're just stressed all the time. And I think that's really smart, especially as we head into the election. And there's emotions are running high, I think, across the nation, regardless of what your political beliefs are. And I think we need to be really cautious of our mental health as we walk through the next couple of months, because you know, we're also entering cold and flu season, and the pandemic is still happening, and all of the problems that we've had for the last 8 months haven't actually been solved yet. So I think that is really smart, and it's a really good point that we need to take mental health breaks. Somebody I talked to earlier today suggested ending your meetings 5 minutes early so that you're not going from meeting to meeting to meeting to meeting. And so she actually had her admin block off the 5 minutes right before her next meeting started. And she's got a Peloton. So I guess there's a mindful meditation thing you can do with Peloton. And so she allocated that 5 minutes as like meditation time in between meetings.
That's really impressive. That's like really good self-care.
I was very impressed when she said it. So I'm going to tell you my self-care tip of what I did today, because I told you back to back meeting. I had 30 minutes in between my call and my next call. And it's the only time I had 30 minutes between anything. And I ran to get frozen yogurt in that 30 minutes. So I think having that self-care is really important. And whatever it is, I mean, frozen yogurt may not make your life better, but it definitely makes my life better. So I think you need to find, or whether that's 5 minutes before you start your next lecture, you need to make sure that you take that time to mentally clear your mental space. We talk about good sleep hygiene and going to sleep and putting away your electronic devices. I do not do that. I really need to. But I think it's really smart to remember to take breaks if you can.
Yeah, I do back to back Zoom patients for work, and I will be 2 or 3 minutes late to get up and walk between patients, because usually I would go get a patient from the waiting room. And I took for granted that was like a thing that helped me. It helps actually transition from like the weight of one patient to the weight of the other, and lets you let go of one and get the other, turns out. And I had no idea. And I was just like, oh, next patient. And I was like, why are these days so horrible? I mean, besides like just sitting there and being drained, right? But I wasn't actually like at all letting go. It was just like piling on, right? So I will like get up and go get a drink of water from my kitchen, even though I don't need to go to my kitchen, because it makes me move out of my office and like just do that. I will go walk a lap around my kitchen for the same thing. It doesn't take a lot of time, but it just forces me to just sort of be like, that patient is gone, like next patient. And then yes, I might be 2 minutes late, but they can deal, right? Like It's not great in psych because of the frame and stuff, but they can deal with it. It's like, you know, I get a pandemic bogey 2 minutes, right? But I think like I do that. I have stress putty. I've always had stress putty on my desk. I think that's helpful. You can't see if I'm goofing with it under here, you know, they can't even see my hands. They're here, right? You can't see them. So like there are things that you can do if you're stressed at like work and meetings on Zoom that you wouldn't be able to do in a in-person meeting. Like you can goof off with a stress ball. You can't see, I mean, you can't see it. So I think you can think about those things too. If you're someone that is like going into a meeting that you know you're not going to like, you can try to think of things that might distract you or ground you in a way that you wouldn't be able to do, because they'd be like, why are you holding a stress ball to meet with me? I'm your boss. That's bizarre. Or like, you know, but you can do it because they can't see your hands.
Yeah, I think that's so important. And it's funny because a lot of times when, you know, when we talk about these things, a lot of them seem like common sense, but we don't think about ourselves in that way. And so, I mean, just like you said, getting up today, I got up and I stretched for 30 seconds in between calls and I felt like a new person. And I had never done that in between Zoom calls. And I thought to myself, I've been in this pandemic for how many months? How did I not think that just standing up and stretching for 5 minutes would help me and make me feel like mentally a little bit better? So I think we've been, especially in the healthcare world, we've been so focused on taking care of the world and taking care of everyone else and taking care of our patients and our families and our communities that we've forgotten that we need to remember to take care of ourselves. And that, I mean, especially if, you know, as somebody mentioned earlier, you're feeling isolated, you're feeling alone, you need to make sure that you're thinking about yourself, whether it's, you know, going for a walk or a run or exercising or doing something. You just need to make sure that you're really thinking about what you need to keep yourself centered. So with that, we've got about 3 minutes left. So Jessi, any last words, any last pointers or tips for everybody to get through the next however long we're going through this pandemic?
Sure, I can do my best. I would say be nice to yourself. We're not, especially as women, but just in general, we're not nice to ourselves. Like we yell at ourselves for everything, for having feelings, no matter what the feelings are. You would be a lot nicer to everybody else if they had any of those feelings. So be nicer to yourself, be my first thing to say. Especially now, because there's a lot that is harder, right? If you can't get everything done that you want to, it's okay. If you can't concentrate as much, it's okay. Like I am aware that might mean your research progress is not as good, and that's a whole nother thing, and I'm really sorry. But you know, it's complicated, but we'll figure it out, right? We'll get there. And I think it's okay that that we're not okay, you know? And I think we have to do that. I think that we also have to say, like, we still need to take vacations, whatever that means. I'm really bad at remembering that. So like we can't go anywhere really. Like you can sort of go some places. And so because we're not going to meetings and we're not going all these places that we would usually go, we're just really stuck like around, like stuck, physically stuck, you know? And I think that makes it feel like we don't get breaks as much from work, and that can be hard too. So you might want to like working some days off where you can, because I think that helps with burnout, because we're just at work a lot now, and that is hard. And then I'd say 3, there's no wrong time to ask for help. So if you need help, ask for it. People are not that scary. They're pretty nice. And I do all this stuff because I think I'm okay. So like,
No, you are wonderful. Thank you. Thank you so much, Jessi, for all that you do for all of us, for everybody out there, you know, for your patients and for all the healthcare workers you've helped. I know you've had a major impact on a lot of people out there. So thank you from all of us for everything that you're doing. I know it must be exhausting for you as well, but we appreciate you a great deal. To everybody else who joined us today, thank you for joining. Remember, you get 25% off of the Women in Medicine Summit. Register. NUWIM25 is a discount code. If you are the 5th person to register after this webinar, you will win a WIMS t-shirt, which I'm going to tell you, it's a pretty stylish shirt. You'll be getting an email from the meeting management team with the CME certificates, as well as a video of this recording and the beautiful graphic recording that, that Lauren has created live for us today. So thank you again for joining us. Thank you to Dr. Jessi Gold for being our wonderful guest at this last webinar before the summit. And I will see all of you October 9th and 10th virtually at the Women in Medicine Summit. Thanks so much, everybody. Have a great rest of your day.